Liposculpture Talk, Episode 6. One thing we do at Liposculpture Talk is we classify plastic surgeons and lipo clinics or practitioners by the technology they use, the devices they use for their procedures. Smart lipo, Vaser lipo, tickle lipo, etc. We talk about their tools. That's how we classify them. Every surgeon needs tools, right? So, for example, on our website, you can find clinics in your area that provide smart lipo. It's useful to know what devices or technologies a plastic surgeon or a lipo clinic or practitioner is equipped with. The problem with that, though, is that no surgeon should be classified solely by the tools they use. And more importantly, though, it's about how they use them.
Lasers alone do not do a good job removing the bulk of fat. That's why we use ultrasound. The laser accomplishes some very, very important tasks.
That's Dr. David Salvador. He's a board-certified anesthesiologist that started the Radiance Med Spa in Palm Beach, Florida. It serves Boca Raton, Fort Lauderdale, Miami. He specializes in liposuction. In fact, he exclusively does liposuction. He pioneered the development of a new liposuction technique called SafeSculpt. It's like a hybrid lipo technology. He combines two commonly used technologies used today in liposuction, ultrasound and laser lipo. He uses the Byron ultrasound device for fat removal, bulk fat removal, and he uses the Synosure Smart Lipo laser lipo technology for skin tightening. Dr. Salvador shows that more importantly than the tools you use for liposuction is the technique you use. He's going to take us step by step through his SafeSculpt procedure now. The first thing he does, like you do in all procedures, is you sterilize the area.
This procedure can be done on what's called aseptic technique, but we always use a sterile technique. We use a bacterial and virucidal cleansing solution to basically completely prep the area so that it's particularly free of germs.
Then he makes a small incision in the treatment area. And then to numb the area, the next step is to
localize the area with what we call tumescent anesthetic. Tumescent anesthetic is a very safe and often used form of anesthesia whereby we place a dilute concentration of local anesthetic in the treatment area. It completely numbs up the area and it completely obviates the need for other anesthetics such as general or intravenous anesthesia.
So he's placed or injected the tumescent anesthetic into the treatment area. Okay, now the next step is the best step. We begin using ultrasound technology. That's when Dr. Salvador uses the Byron Ultrasculpt device. It's used to
remove the unwanted fat. We do that using high-frequency ultrasound. We're able to use fairly small instruments that are smooth. Unlike traditional lipo instruments, which remove the fat as a solid and have to be much larger by nature and have cutting blades that cut the fat, because we're going to melt the fat, that is emulsify it, we're able to use much smaller instruments, which provides for much more patient comfort, much more rapid healing, and allows us to do the whole procedure under local anesthetic.
Ultrasound. Patient comfort and the results you can get with lipo has evolved because of it. So now Dr. Salvador is now working away with the ultrasound probe. It's melting and emulsifying fat from the treatment area.
We melt the fat using high-frequency ultrasound, which essentially heats the fat and emulsifies it into a liquid, which we can remove very safely and very easily through a small incision using small instruments.
And here we're looking at the product of our efforts, a finished canister of fat, which is
an emulsified layer of fat that is coming from the treatment area.
One thing that this Byron Ultrasculpt machine does is that it melts and removes fat at the same time. So there's one incision, one probing device to emulsify and to vacuum.
We can continue to work in an area until no more fat comes back, so we can all but guarantee a patient that wherever we've treated, all the fat cells are permanently and safely removed.
So far, the first two steps are to use local anesthetic to numb the area, and then to remove the fat using the high-frequency ultrasound. That removes the bulk of the fat. The third and final step in treating an area is to introduce the laser lipo or laser lipolysis. Dr. Salvador uses the Smart Lipo brand, the Smart Lipo device of laser lipo by Synosure.
Smart Lipo is a specific type of laser. It works on the 1040 wavelength, and it's excellent for targeting unwanted fat. Lasers alone do not do a good job of removing the bulk of fat. That's why we use ultrasound. The laser accomplishes some very, very important tasks. The first thing it does is clean up any small pockets of fat that are left by the ultrasound. The second thing it does is cauterize, that is sealed by heat, any small little capillaries or blood vessels on the undersurface of the skin. This dramatically improves healing by reducing the amount of swelling that a patient may experience after the procedure. The third benefit is that the laser causes a temporary contraction of the skin. The heat that the laser applies to the skin allows the collagen molecules to contract. This is a short-lived process. It lasts for 3 to 4 days, but it does help significantly in rapid readhesion of the skin and the muscle once the procedure is over. Of course, the fourth and final benefit of the laser and why we do this is to promote new collagen. We know from many years of experience that heating the skin to a critical temperature of approximately 103.5 degrees Fahrenheit or 40 degrees Celsius dramatically increases the amount of collagen in the skin. In 3 to 4 months, new collagen is formed, which then cross-links and imparts a tightening to the skin. The reason we get significantly better results with this procedure, in contrast to traditional lipo, is in addition to removing the fat safely and without traumatizing the skin, we actually do a lot to help the skin achieve a much better state of health through improving its collagen density. The laser is relatively small, approximately 1.5 millimeters or about the head size of the pencil head.
Keep in mind that these steps in Dr. Salvador's Safe Sculpt procedure aren't typical what you're going to find in a lipo procedure because he's using a hybrid of two popular lipo technologies, ultrasound and laser lipo. He's using the best of what technology has to offer and getting even better results by combining the two technologies. Dr. David Salvador's clinic is Radiance Med Spa. They've been serving patients in Palm Beach County in Florida for over 20 years. You can find them online at safesculpt.com or call them at 888-612-LIPO.